Hello, welcome to the webinar on the Nurse Midwifery program and the dual Nurse Midwifery F&P program. Let me start by saying we're glad you're here. Midwifery needs to become a more diverse workforce to serve the women who most need midwifery care. We want to ensure that our cohort represents and looks like, mirrors, is able to serve all the populations that need midwifery care in the U.S. and to some extent globally. We're very U.S. focused because that's the skill set we're providing, but we are very aware that midwives also need to go out into other areas where there aren't maternity care services and serve there as well. So we really want to enroll a diverse cohort. We want to include all the people who want to be part of our profession. In this webinar, we're going to talk about the two specialty programs, Nurse Midwifery and then Dual Midwifery F&P. The Nurse Midwifery program is 4 semesters, it's 53 credits. You'll end with an MSN at the conclusion of the program. If you're interested in getting a DNP, we have options where you can seamlessly transmit into the DNP and take fewer courses within the DNP because our MSN curriculum is really aligned to feed beautifully into the DNP, but it is not a requirement for enrollment in this program. We'll talk more about the DNP on some later slides. So with the dual students, they are basically with the midwifery cohort for those first 4 semesters, and then they have an additional semester with additional coursework and additional clinical practica that thoroughly prepare them to care for individuals across the lifespan, both men and women, or all genders rather. And so it is 5 semesters and 65 credits. Those individuals also end with an MSN on completion, but can seamlessly transmit into our DNP program. So with the certification exams for both of these certification, you'll complete them at the end of that program of study. So with Nurse Midwifery, our students graduate in December, and most of our students take their board exams in late December or early January while they're really fresh. They've just gotten done with their comprehensive exam and they are completely ready to go and sit for AMCB board exams. Both our Nurse Midwifery students and our dual Midwifery F&P students take those midwifery board exams at that time. Then our dual students would go on into their final semester and they would take their board exams for F&P after the end of that final semester. I'm going to talk a little bit about our faculty first, in part because you'll hear some faculty voices on this webinar, and I wanted to orient you to who they are. We intentionally have faculty who represent unique perspectives and experiences in midwifery. We have nurse midwives who are active in practice, both now and who have a rich history of practice that they bring to their teaching. We have faculty that are actively engaged in research, and we, across the program, are interested in teaching excellence. We really want to make the best possible nurse midwives to serve the needs of women and families, or individuals and families. You're going to interact with the course faculty in a whole bunch of ways. They are obviously your course faculty. All the core midwifery courses are taught by a nurse midwife. You will also have a student advisor who you will meet with each semester to check on your progress. And you will also have tracking faculty in your clinical courses. So your clinical courses where you are with preceptors the vast majority of the time for that course. You also have clinical conferences where you meet with those faculty and they also see your case studies. You get to present to your colleagues and really show how you're applying evidence into practice and how your charting looks. And those tracking faculty are with you through that. They do site visits, so they come to where you're learning and see you in action. You will also have faculty who are your preceptors. So we do have volunteer preceptors that we find for you, but some of our faculty members are also active in practice. So for instance, I often will see our students or preceptor students while I'm on call. So you'll get to meet and get to know your faculty in a whole bunch of different ways. Let's talk a little bit about the individual faculty, because we all bring something different to our teaching. So I'm Julia Philippi. I'm the specialty director for the nurse midwifery specialty. I have practiced. So before I got my nursing degree, I apprenticed with a lay midwife and did home births. And then I came through our bridge program. And then I've worked in birth centers, rural hospital, but birth centers, both urban and rural birth centers, with both underserved and affluent women. And then I've also done a small rural hospital, itty bitty tiny rural hospital, and also practiced at Vanderbilt as well. My area of research is access to care, particularly how the structure and format of care influences women's ability to get care and their desire to get prenatal care in particular, and also their outcomes of intrapartum care and perinatal care as a whole as a result of the structure and format of care. If you're interested in the faculty publications, we each have a faculty webpage that you can visit, and you can see our publications. Several of us have Google Scholar accounts as well, so it's easy for you to link to those and actually see the pubs if you are interested in reading that. Melissa Davis is she is one of the faculty members here. She's dual prepared and has really done dual practice throughout since she graduated from our program. She's also the practice director of the VUSN faculty practice that has 2 clinics, Melrose and West End, that provide both midwifery services and then also primary care services. And she's been instrumental in bringing that primary care into those clinics so that we could provide a full range of care for individuals there. Stephanie Devane Johnson joined us from Duke in fall of 2019. She's wonderful. Her research area is breastfeeding for African American women, and her practice area has really been outpatient midwifery care, particularly GYN care, and she teaches it in our women's health course. Tanisha Douglas is one of our faculty members. She primarily is in full scope practice at Baby and Company, and then also teaches with us in some of our clinical courses as well. Dr. Diane Folk is one of our core faculty. She teaches in a variety of the midwifery core courses, and her practice area had been in collaborative interprofessional practice with maternal fetal medicine specialists, so doing a lot more higher risk care with individuals and their families who may not be experiencing a low-risk pregnancy. Tanya Moore Davis is one of our core faculty as well. She also teaches in the women's health program. She also practices over at the faculty practice as well. Her areas of interest for research have been genetics and mindfulness. And Dr. Jeremy Neal is with us. His primary appointment is in research, and he looks at labor patterns, particularly for low-risk women, and also some work in the disparities and how we can alleviate disparities in labor care. And he teaches in some of our professional issues courses and clinical courses in his area of expertise. Dr. Mavis Shorn teaches with us some. We would like to see her teach with us more, but she's our associate dean at the school. And so most of the time she comes in for guest lectures on things that, on areas of interest or expertise for her. Her research is in third stage management. So particularly what interventions affect the outcomes of third stage, and really what people are doing in third stage. She's noticing that there's a lot of national variation and also variation by care provider, despite the fact that there are safety bundles for third stage management. So this gives you a little bit of a picture of what we each bring to the educational environment. And we really feel it's important that we bring diverse experiences to the classroom so that when you guys ask questions, we can answer it from a variety of perspectives, because midwifery is not monolithic in the US. There are regional differences, there are clinic differences, there are differences just based on what that population needs. And so we want to bring that to you. Let's talk a little bit about program entry and exit. We have a whole bunch of ways you can enter the program and 2 ways that you can leave it. This group of ladies here on the stairs is the cohort that graduated in December of 2019. So to enter the program, you can enter with a non-nursing bachelor's as a pre-specialty student. So with that, you would come in with a bachelor's degree in a previous field, and then the first year here on site in Nashville would be doing all of your nursing training. People often ask if pre-specialty students get jobs when they get done. Yes, wholeheartedly. We don't have a problem with employment of our graduates. In part, we're a highly ranked program. We do a lot of training so those graduates are ready to enter entry-level practice. And our pre-specialty students work very hard. They're very bright, and they learn during the course of time with us. Do they have the same robust experience as someone who's coming in with 10 years of labor and delivery experience? No, but they're also very much better able to take on the role of a nurse midwife because they're not having to unlearn a previous role. So our pre-specialty students do very well. We also take people who have a previous RN but not a bachelor's degree. So those individuals would come into our RN pre-specialty program, and that's a modified distance program in that first year where they're here for blocks. And they would be basically working on getting the bachelor's portion of that VUSN, and then they would roll into the specialty after that year within that program. Or people can enter with a previous BSN, with or without previous labor and delivery experience. Although labor and delivery experience is a perk, it is not required. We also take people who have a previous master's in another APRN specialty or a generalist master's. So for instance, Johns Hopkins has a generalist master's. So if you have a previous master's, you would be coming into our postmaster's program. Those people enter directly into the specialty. Exit paths include ending with your MSN that we talked about, or if you want, you can go straight through into your DNP, and that's an option for you, but is not required. So we talked about this in some previous slides. Most people end with a Master of Science in Nursing. We have had several people that do that optional seamless transition into the DNP, and we would work with you and make an individualized curriculum to make that happen. And the graduates on the top left are the graduates from 2019 spring. So those are some of our dual students. So what does it mean to be a nurse midwife? We want to make sure that we're educating you for what your goals are, and that's very important. So as we're looking up your application, we really want to make sure that you do want to be a nurse midwife. So nurse midwife means with woman. It doesn't mean that the care provider is a woman. There are plenty of midwives who are men, and that is absolutely fine. They do a great job. It has to do with what you bring to the woman, not necessarily the characteristics of you. Nurse midwives are educated in both nursing and midwifery, and we do take that seriously. Our pre-specialty students have a wonderful, rigorous pre-specialty program where they do learn a lot about nursing. I have to admit that when I went into midwifery, I just kind of wanted to get through nursing to get to midwifery, but the skills I learned in that introductory year were really foundational into my success in midwifery. Midwives also provide primary care for, and this slide says women. There's a new core competency version which should be officially approved by the American Midwifery, the American College of Nurse Midwives in the next few weeks, that will decrease the time we use women and instead increase the time we're using individuals. So we do provide primary care for individuals, although I will say we generally don't provide primary care other than sexually transmitted infection treatment for individuals who are assigned male at birth. In general, we're working with people who are assigned female at birth. We provide full scope reproductive care for them, including GYN care, contraception, preconception care, health conditions, including hypertension, asthma, thyroid conditions, basically your acute outpatient conditions that you would say go to the walk-in clinic for or go to a regular primary care provider, and some chronic conditions. In general, nurse midwives are not caring for people with multiple chronic conditions. If you're interested in that, the dual program can give you that additional training. We provide intrapartum care, which does mean we are on call nights and weekends as part of our job and as part of our call structure for when you're here with us as a student. Nights are an essential part of providing full scope midwifery care, and really being on nights, I only take call at night now. You get a lot of wonderful natural births at that point because a lot of people are just coming in labor, having woken up out of a sound sleep in labor, and it's lovely. If for some reason you have a documented health reason or a disability that you couldn't work nights, you can see our student access services and they can help you with a plan for that. But I will say that without having a disability, nights are an expectation of call and then also of the career demands. We provide well newborn care up to 28 days, which predominantly encompasses assessment of the well newborn. We don't provide care past 28 days unless you are dual certified. And we have a whole newborn course for you, just like we have a whole primary care course for you. And nurse midwives practice in a variety of settings. It is amazing the places where nurse midwives are at this point. We do rural and urban care. We do birth centers, hospitals, home births. I'm trying to think, there's just so many. We provide full scope reproductive healthcare services. There are midwives out in the community and some of our former grads who are providing gender affirming care to individuals who identify as transgender. That's not part of our core skill set at this point, although we're adding some once those core competencies get promulgated. It won't be all the training you need though, for instance. But we provide a full spectrum of care for individuals to meet their health needs.
So let's talk about the American College of Nurse Midwifery philosophy. One, it focuses on prevention and education. We're really the experts and advocates for if we can prevent something from happening, we will, and we try to rather, and we are education experts. We tell patients and families sometimes more than probably what they want to know, but I always want them to see both sides and to be able to have the right information and to have informed decision making. We view menses, pregnancy, and menopause is all a part of, it's normal process. It's all a part of living and aging, and it's nothing abnormal. But midwives are trained in the normal and to detect the abnormal. So if something with the pregnancy is not going textbook, then we know that it's not textbook, and then we're able to intervene. We have the knowledge base and we have the tools to be able to say, okay, then we need to do X, Y, and Z if blood pressure goes up or diabetes or something like that. And we always consult with our backup physicians. And we provide compassionate, family-centered care. Love taking care of families, and they become part of your family after you deliver a baby, and then you might see them postpartum, and then if you live in the same side of town or in the neighborhood, you see them at the mall, you see them at the grocery store, and it is amazing how the bonds and the relationships that you are able to foster with the midwifery profession. And like I said before, encourage individuals' participation in decision making. Here are your options. And then as long as you're okay and the baby's okay, and it's not going to harm you or your baby, then we can do X, Y, and Z. I'm always the type that I say, I put everything out on a silver platter. These are your options. You pick and choose like it's a buffet. Because people, you want to have control, and people need to be the locus of control in their and what is done and how the labs or how everything plays out as far as birth and labor and delivery. And we use technology and we intervene appropriately. As long as everything is going textbook, all the stars are lining up and everything's perfect, we are hands off. But we also have the tools and the knowledge base to know and to intervene when we need to. If the baby's heart rate doesn't sound normal and we're concerned in some way, then there are things that we can do. We get ultrasounds when we deemed appropriately, and we consult with physicians when appropriate. Again, practice settings for nurse midwives. There are births at hospitals, birth centers, and home. There are physician-owned practices. There are nurse midwifery and advanced practice nurse-owned practices. There are ambulatory care centers, rural, urban-based, work site-based clinics, faculty practice in an academic setting like Vanderbilt, correctional facilities, Indian Health Services, migrant clinics, military service, international health departments, you name it, and midwives can be a part of it. It is a wonderful profession to be able to, if you want to travel, you can travel around the world before you settle down, or if you homegrown and born and raised in an area, then you can go back to that area and deliver probably some of your family members and close friends. It's kind of like having, to us, the best of both worlds. It is a priceless profession, and it has served me well, and I love it, and I would love to help foster and midwife you all through the midwifery education and into the profession.
In order to prepare you for that type of practice in the U.S., where you can be in all those different settings and providing all that different types of care, we base our curriculum in the midwifery program on the American College of Nurse Midwives core competencies. If you're interested in more granularity as to what's in those core competencies, you can go to acnm.org or midwife.org. Those core competencies are being updated currently in a new version of them that is anticipated to be much more gender neutral and much more gender welcoming, or gender diversity welcoming, should be available in the next few weeks. And after that's approved, we will be moving our curriculum towards those new core competencies. Let's talk a little bit more about the differences between our midwifery program and our dual CNM F&P program. As you consider whether you're interested in one or the other, what we really want you to do is to decide which curriculum best meets your goals for where you want to practice and the scope of your practice. So think about what population you are interested in serving, and whether you want to provide care to people who are assigned male at birth and females across the lifespan. And then if you're interested in providing care for chronic conditions, particularly people with multiple chronic conditions, that would encourage you to go towards the dual route, for instance. Also, where you want to practice. If you're going to move into a rural area, the dual program may be ideal for you. Or if you know you want to do work abroad, having a bit more scope on chronic conditions could be helpful for you as well. The Family Nurse Practitioner program is the last semester of the dual program, and it helps people specialize in primary care in multiple settings. It includes all ages and gender, so children, people who are assigned male at birth, all genders, managing both acute and chronic conditions. They also integrate health promotion and disease prevention as well. So if you want to go beyond the midwifery scope of practice, if you want to provide primary care that extends beyond midwifery, the Family Nurse Practitioner program can really give you those skills. And our website for the Family Nurse Practitioner program and the dual program can give you a lot more information on those as well.
Hi, my name is Tanya Moore Davis, and I am one of the midwifery faculty members here at Vanderbilt School of Nursing. I'd like to take a few moments to provide an overview of clinical experiences for our midwifery students. This slide provides a graphical depiction of the full-time plan of study from a midwifery clinical rotation perspective. Students entering as pre-specialty students would first complete clinicals in the pre-specialty year, denoted by the blue box on this slide. Students entering as direct entry students, having already completed a degree in nursing, would eliminate this blue box. Also note that if you are a dual specialty student, meaning you plan to complete the F&P program at the end of your midwifery training, you should add an additional semester, commonly called Spring 2, on the right side of this particular diagram. That's when you would complete all of your F&P related clinicals. We'll explore each semester's clinical rotations a bit more in depth in just a moment. This graphic provides an overview of the midwifery clinical rotations for students who choose a part-time plan of study. Again, pre-specialty entry would require completion of the blue box or the pre-specialty year. Direct entry students or students with a prior nursing degree could eliminate this blue box. As mentioned previously, dual students who anticipate the one additional semester for the required FNP clinicals would have an additional spring semester or spring 3. The major difference between a part-time and full-time plan of study is when the student begins clinical rotations. Full-time students have clinicals every semester, starting with fall 1 of the specialty year. Part-time students, however, complete their core coursework first, then begin clinical rotations in their second fall semester. We as faculty often get questions from applicants about clinical rotation logistics. I'll try to address some of those most common questions now. First of all, students are required to relocate to Nashville for at least the first 2 semesters of their midwifery specialty year. That is the fall and spring semesters. Many students consider a 9-month lease when looking for housing, as students are frequently asked to travel outside of the Nashville area for the summer and final fall clinical rotations. All students will have at least one rotation outside of the Nashville and Middle Tennessee area, so flexible housing arrangements are a requirement. Next, with the profession of midwifery comes some non-traditional work hours. Students should expect to work many night shifts and even some weekends, especially in the summer and final fall rotations. Babies are born at all hours of the day, after all. So during clinical rotations where you are attending births, students will frequently be scheduled for nights, weekends, and even some minor holidays. Reliable transportation is a must. Many clinical sites used by the VUSN midwifery program are outside of the reach of our public transportation system. Students should expect to drive to clinicals and will need a reliable form of transportation for the duration of clinical hours. Let's now take a deeper dive into the logistics of each clinical rotation to give you a better picture of what to expect. In the first clinical semester of the specialty program, students have a single clinical day, approximately 8 clinical hours. This clinical experience is completed at one of the Vanderbilt midwifery faculty practices here in Nashville. Students work one-on-one with a preceptor from the practice and apply history-taking, physical assessment skills, and even perform their first pelvic exams on women, both pregnant and non-pregnant. For the second clinical semester, the spring, students move into the outpatient clinical realm. They focus on providing care to prenatal, reproductive, and sexual health clients, as well as primary care situations. That spring of the specialty year, students will be in clinicals 3 to 4 days per week and accumulate nearly 280 clinical hours. These hours are split across 2 different clinical rotations, one in outpatient prenatal care and well-woman gynecology, and the second in primary care. Each of these clinical rotations are 6 weeks in length, and they are completed consecutively rather than concurrently. Students again work one-on-one with a preceptor from their assigned practice to provide care to clients. The map image is on this slide because these sites for these 2 clinical rotations can be anywhere within a 4-hour driving radius of Nashville, basically somewhere within this yellow circle. During this semester, students are only on campus for Monday classes. Then they're able to travel and stay at their clinical site for Tuesday through Friday. For the third clinical semester, students begin attending their first births as students. The scope of the summer clinical includes labor, birth, postpartum, and newborn client care. Beginning in the summer semester, students are placed in clinical sites around the country and sometimes abroad. Locations include things like midwifery practices in Tennessee, midwifery and alumni locations across the country, and even in international military sites. Students are assigned to their clinical site for upwards of 48 hours per week, and they accumulate a total of 280 clinical hours. During this semester, students complete a month-long clinical lab intensive on campus during the month of May. Then they travel to their clinical site for the months of June and July. Classes are held online while students are away using video conferencing technology. We use diverse clinical sites, hospitals, both tertiary care hospitals and community-based hospitals, as well as birth centers. Students have the opportunity to be exposed to birth care both in hospital and out of hospitals. This image is one of our clinical preceptors attending a birth at a birth center where water birth is offered. The Summer on-Campus Intensive during the month of May is designed to prepare students with all of the birth and newborn assessment skills needed for that summer clinical rotation. It's an intense month of lots of hands-on lab work that creates some of the most memorable moments of midwifery school for our students. The student in this image is practicing suturing lacerations on a beef tongue. The skills lab in the summer semester uses both low and high fidelity teaching methods. This picture is of students using some of our simulation models in a low-tech example. On the right, students are dressed in parto pants, basically scrub pants with a vagina and perineum sewn into it. The wearer of these pants maneuvers the baby through, and a student is able to play midwife, catching the baby as it exposes itself from these parto pants. By the final fall semester of midwifery clinical rotations, students are ready to begin putting all of the clinical pieces together and functioning in the full scope role as a midwife. This rotation is appropriately named integration and is similar to a senior capstone rotation. Students kick off this final clinical semester by completing an on-campus intensive for about 7 days during the month of August. Then they travel to their assigned clinical site for the months of September, October, and November. The semester will end with another 4 to 7 day block of time on campus during December. During this final clinical rotation, students work alongside an experienced preceptor midwife, living the professional life of being a midwife. They're attending births, seeing clients in the outpatient setting, and caring for women across the lifespan. The clinical schedule averages 4 to 5 days per week, usually composed of 24 hours of inpatient call coverage and 2 to 3 days of outpatient clinical care. The goal is to accumulate 350 hours of client contact time during this semester. Vanderbilt School of Nursing uses clinical sites in Tennessee, across the country, and at military bases abroad for this integration rotation. The integration experience is a lot like birth. It allows students space to come full circle and put the finishing touches on their development, becoming a midwife. Our preceptors are the heart of our clinical experiences. Students who attend the Vanderbilt Midwifery program are never asked to find a clinical site for themselves during the program. Faculty work together with our clinical placement office to identify the sites for all of our students. This is not true of all midwifery programs, but it is a huge advantage of the Vanderbilt program. We maintain a large database of potential clinical sites, maximize our alumni connections and network, and often are building new relationships around the country. Our local clinical sites in the Nashville area include a host of Vanderbilt Midwifery faculty practice locations, such as our West End office, Melrose office, and Mount Juliet Clinic. We also are privileged to be able to partner with local organizations such as Baby and Company Birth Center to create a unique out-of-hospital learning experience for our students. We also partner with other birth centers around the country, but it's wonderful having partners like Baby and Company in our backyard of Nashville.
After the clinical semester, usually the full cohort and faculty go to the ACNM annual meeting. That meeting is in different places around the nation, and we take this as an opportunity to all go together to the largest gathering of nurse midwives in the U.S. You can see some of the pictures of our previous cohorts going. Sometimes our students have been selected by their peers, so by other representatives from other programs, to give the student report in front of the entire annual meeting. And that's been such an honor to have our students up there representing our program. Our students generally get lots of awards at the annual meeting. There's one assignment that you do in your first semester here that can be submitted for an award from the American College of Nurse Midwives Foundation. It's a history award where you interview a nurse midwife and then you catalog that, and those interviews are archived for historical purposes, and our students then submit for awards for that. We also have lots of students that have gotten scholarships, other wonderful things when they go to the American College of Nurse Midwives, so it's been really fantastic. There's also a lot of networking that goes on at the American College of Nurse Midwives. There's ways that the students can page meetings, so they're kind of the go-to person for that particular session. And one time I had someone call me up out of the blue at the school and say, one of your students paged the meeting I was in 2 years ago, and I loved her and want to hire her. And so we had to go back and think about what meeting that was and which session she was in, and I luckily could remember which student it was, and I was able to connect them. That student ended up having a fabulous job that she wasn't willing to leave at that moment, but it does show that the networking that you do at that annual meeting often pays off in connections that really do persist and help you get the jobs that you want across the nation. We have lots of programs for you to be involved past the classroom here at Vanderbilt, and to be a leader and to demonstrate that leadership for your future employers, and then also to get the thrill of being a leader in a safe space where you have some support. So we have the Vanderbilt program in interprofessional learning. This is predominantly available to our pre-specialty students, because what you do is you come in and you're assigned a group of interprofessional students, including pharmacy, medicine, nursing. I think there's one other. I think PT has sometimes been with those groups. And those groups go together to clinical experiences, both in the pre-specialty year and the specialty year. And that way you learn from other students who have different curricula. So they might face a particular patient problem in a different way. And our students that have done VPIL have really enjoyed it. They get some additional training in how to work together that I believe really does persist. We're running a study right now to see if there's actually a quantifiable difference between VPIL students and non-VPIL students. Our students are really fabulous all the way around, so it's hard to get that difference. But the students that have participated in VPIL say that it was a seminal experience for them in their master's. So that's available to you. We also have the volunteer doula program. So our students, it's a student-led volunteer doula program. In fact, it was actually created by a student while she was here. So the students run this program. It provides a training. So individuals who are interested in being a volunteer doula can come. They get a full Saturday of training on how to be a doula. And then there's a volunteer doula calendar where you sign up for shifts on the calendar. And you basically take call, and if there is a woman over at the medical center or at the Baby and Co Birth Center, the provider on call, the provider who's with the woman or the nurse that's with the woman will call they'll call a particular number with a Vanderbilt Volunteer Services, and they will then page the doula on call, so that you can get the experience of being a doula without having to fully commit to constantly being on call for your doula clients. It also allows low-income women the opportunity to have continuous labor support with them without having a fee. So we really feel like it's been good for everyone involved, because low-income women get continuous labor support, so they're more likely to give birth vaginally and have a better birth experience. And our students get the opportunity to be in labors and to provide labor support throughout the time that they're here in our program. It's been wonderful. I've actually called the volunteer doula program several times when I felt like it would make a difference for women. Once I had a woman come in who had no support system. She was here from a foreign country, and her husband had been delayed, and as well as her mother. And so her father had to go back and care for her older child. And so he just dropped her off at the hospital. And I was able to call the volunteer doula service and say, look, this woman is totally alone and just needs someone to come and be with her. And it's a really wonderful service. We also have Global Health Certificate available. So if you're interested in global health, we are, as a curriculum, very focused on the American College of Nurse Midwives core competencies. Those competencies overlap the International Confederation of Midwives essential competencies, which is what midwives across the world use as an essential document for what constitutes competency for basic midwives. So we are consistent with that, but we do not provide global experiences for our students as a general rule, except in the Global Health Certificate, in part because we're very aware of power differentials and not using other countries as a learning experience. Instead, it would need to be mutually beneficial. So our Global Health Certificate really does offer additional opportunities for you to work on deep thinking how you would improve care or what care would look like in other countries. And we've had several students complete the Global Health Certificate and really feel like it benefited them because of the way it helped them approach global care. If you're interested in the Global Health Certificate, there is an entire web page on it on the website. And Carol Ziegler is the lead for the Global Health Certificate. We also have STEP, which is the Shade Tree Early Pregnancy Program. So Shade Tree is a completely student-run clinic that is interprofessional. The nursing school and the medical school run that clinic together. And then on the first Saturday of every month, there's a pregnancy program where women can come in and get a free initial pregnancy visit, so like a first OB visit. And our students completely run that as faculty, both faculty within the core program and then our clinical faculty from the faculty practice service attendings. So when I go, I sign up, I'm told to show up. The students send me what I need to do before I arrive. I stand in the room while they do visits. I give them some additional tips and training, and they do everything. The lead student will take the lead. There'll be both nursing level students and midwifery students and medical students there. They decide who's doing what portion of the visit, and they provide the visit, including translation services. So a lot of times we have an on-site translator for Spanish and sometimes other languages as well. Nashville's a remarkably diverse city, so we may need Burmese translators. We have a lot of Somali women. So we do have phone translation available for less common languages as well. But it is a wonderful program to both participate in and then also lead. In fact, our students that are the leaders this year and the previous year are working on a publication together, and we've gotten several students to get their first publication through their participation in this program and writing up what they've done or how they've worked on quality in this way. Let's talk a little bit about the certification exams. We talked about those before, but I feel like they kind of belong at the end of the PowerPoint because in part they come at the end of the program. So for certified nurse midwives, you need to take the American Midwifery Certification Board exam, and you can get on their website and look at what the test blueprint looks like. They publish a test blueprint. You know exactly how many questions are coming from each area of practice. We've had 100% first-time pass rate on the AMCB board exam for over 4 years. And we take pride in our pass rate. In part, we prepare our students well for the exam from the very beginning of each class. So a lot of our classes involve pre-quizzes so that you have some accountability to do your reading. It's hard when you're really overwhelmed to want to do your reading, and having those small quizzes that don't account for much in your grade, but they do help you know that you have to get ready for the class, so that when you come to the class, we spend a lot of our class time in interactive discussion. We have many flipped classroom models because we really feel like that expedites your learning. In addition, we do multiple choice tests so that we can encourage you to be prepared for those certification exams. We also have some fun, innovative stuff we do in the final semester called snack learning, where we send you out prompts throughout your final semester to help kind of gently nudge you to be studying for board exams as well. We're super proud of our pass rates. If you're going on through the dual program, you would take one of two certification exams, either the ANCC exam or the AANP exam. They'll talk with you about the selection of which one you want in the F&P portion. They also have very strong pass rates. I don't have those off the top of my head, but they are published online. We have a page that shows you the pass rates for all the exams for all of the programs that we have at the School of Nursing, and you are welcome to go to that page so that you can see what our pass rates look like. We are super proud of our over 345 graduates. This number actually will change in the next few weeks. We're about to graduate a cohort of about 20 students, so that number will go up by quite a bit. Our students are out and about in a variety of practice sites. They become our colleagues and our friends and our preceptors, and we enjoy talking with them and calling them, working with them as they precept students, and seeing them at annual meeting as well. This is an older slide, but you can see that our graduates are across the nation. We do now also have some in Idaho and Utah. Those areas were sparse for a while, and now we have someone in Salt Lake City and a graduate in Pocatello, Idaho that just moved there last year. So our graduates are out and across the country. We've also had graduates who practice abroad. Most of those practice abroad for a stint of time and then return to the U.S. Let's go over some common questions that we have about our program and about the application process. Salary, how much do our graduates make? It varies a lot, in part because what you bring in general, you should bill about 3 times what you make. So we have students that go into very brisk practices where they're seeing lots of women in a day. And we have had our new graduates, at least 1 or 2 in a cohort that get a $100,000 salary out of the gate. Other students go to lower volume sites or sites that offer more benefits and less salary, and that works for some of those individuals. So say they have a child or a family member who really needs high quality medical care, they may go to an academic medical center where the benefits are very strong, but sometimes the salary isn't as much, but you have a much more protected job structure as far as volume. So in general, our students are definitely getting a living wage. Many of them are also getting loan repayment on top of their salaries. Job outlook for our graduates is excellent. It is hard for me to give you a firm employment number, in part because we have the dual students that graduate a semester later. And so at what point do we consider everybody employed by? But we have no problems with our students finding jobs, especially if they're willing to move. Now, it can be difficult to find a job as a new graduate in Nashville, in part because we graduate, 25 to 30 graduates a year. And so the job market for new grads in this area is a little bit saturated. If you're interested in returning to Nashville, the usual advice we give to people is to go away for a few years. Once you get 2 years of experience, you're pretty much golden to go wherever you want. So a lot of people do get that first job with loan repayment, or that allows them to grow a particular skill set. And then once they've done that stint there, then they find the job that they want to remain in longer. Both our pre-specialty students and our direct entry students have excellent job prospects. They are very desired as midwives throughout the nation. In fact, we have people calling us up to precept students in their final practicum, in part because they think they want to hire somebody and they really want one of our grads to hire. And so sometimes it works well for them to precept a student in their final semester. It's basically a 3-month-long job interview and some orientation. And then they can decide if that's the person that they want to hire at the end of the rotation. Malpractice insurance. While you are at Vanderbilt, your malpractice insurance will be covered and you do not need a tail. Vanderbilt is self-insured, and so you are covered for the time that you are a student with no tail needed, and that is all part of the benefits that you get with your tuition. Length of our program, we talked a little bit about that. It's 4 semesters for the specialty year. If you're pre-specialty, you're going to add 3 semesters on top of that, same as if you go through our ADN program, right? If you're an RN without a previous bachelor's, you'll add 3 semesters onto that 4. And if you are a postmaster student, sometimes it's a little bit less because you may have had some core classes, or you may not be full-time absolutely every semester because you've had some previous coursework. And for our dual students, you're going to add 1 semester onto the end of the program, which would be really focused on those F&P practica. Cost of living in Nashville. This is really interesting. So Nashville, we complain a lot about our cost of living, but if you compare it to, say, New York or areas around NYU or Columbia or Boston, our cost of living is actually much lower than those other major cities, particularly cities in California and on the West Coast as well. And also it is less expensive if you move slightly out of the city. So for instance, I live south of the city in part because the school system that I need for my kids, I have a dramatically less cost of living than if I were to live in downtown Nashville. So do run some numbers, do look at some apartment complexes, and look at the cost of living. I think you'll find that Vanderbilt compares favorably. And also the compressed nature of our program, because we have a really super intense program, you're going to be in school less total amount of time, which means that you get done faster and you can get up to your higher salary faster. So do spend some time looking at cost of living, because Nashville does really compare favorably to other cities, and it's a really fun city too. Nashville's great to live in. Finding sites. You do not need to find your clinical placements if you are at Vanderbilt. We take care of finding your clinical placements. I think Tanya Moore-Davis talked a little bit about clinical site placements and how we do that in previous slides, but I want to reassure you we find your sites for you, which I think is a big difference from some other programs where, since you're responsible for finding sites, if you don't find a site, you are delayed in graduation. We find those sites for you. We also maintain a vibrant faculty practice. We have over 21 midwives in our faculty practice, and we use that as both an excellent clinical resource site and also a backup site. So it happens sometimes that someone goes to a clinical practice site, their volume isn't what is expected because of something that goes wrong, or hurricane season, for instance. We've had students, their clinical placement is derailed because of hurricanes or wildfires. We bring those individuals back to Nashville and they finish up at our faculty practice to ensure that they get the clinical placement they get their clinical placement needs met, even though there's things going on in the world beyond their control. So please do think deeply about us. We'd love to have you. We think our program is absolutely fantastic. We really enjoy working with the students who come and making them into midwives. That's what we do here. We midwife midwives. So as you think about your application process and as you think about your offer letter that you get, our offer letters come out in mid-February. And mid to late February, sometimes we had one delayed once because of snow. It was hard for us to get those letters out because it was snowing here. Do consider Vanderbilt. Spend some time with our website. Spend some time looking at our faculty pages. We're very committed to providing the best possible experience for our students. This is our cohort that is graduating in December of 2019. And this is at their honoring of hands, where right before they go to integration, we have a midwifery ceremony that has existed for a long time in various midwifery programs where we honor their hands and we send them out with information about the strengths that midwives carry with them. So let's talk a little bit about what we're looking for in the application process. We want applicants who understand the role of the nurse midwife or the dual nurse midwife F&P. Again, our goal is to get you to your goals. And so we want to make sure that where we're propelling students towards is actually where you want to end up. So if you're applying, do spend some time looking at what nurse midwives do. Spend some time shadowing nurse midwives. That's important to make sure you've got the right fit. We don't want you to come into an educational program and spend, a year and a half with us and end up where you didn't want to be. So that's something that we look closely at. We want applicants that demonstrate the ability to be successful in our academically rigorous program. We really do look at transcripts, in part because we don't want to admit students who are not going to be able to be successful in the coursework and go on to be successful nurse midwives. That's not fair of us to admit students we don't think will be successful. So we do a thorough transcript audit and look carefully at your grades in previous programs, because that can be an indicator of your success in our program. In general, people who apply by the priority deadline fare better in the admissions process. Particularly for pre-specialty students, our pre-specialty program fills up by the priority deadline, by the people who apply by the priority deadline. So if for some reason your application isn't successful, one of the things you can do to help it is to apply next time by the priority deadline. We do a holistic review process, so we really do want to balance our cohort as far as characteristics to make sure that we are producing midwives that are going to meet the demands for midwifery in the U.S. So we're interested in recruiting and retaining historically underrepresented groups in nursing, including racial and ethnic minoritized groups, first-generation college students. We're also very interested in supporting our veterans on their path to midwifery, as are many of our sites. So we have sites that, as a prerequisite to taking a student, they want a student to come from one of these groups because they are committed to mentoring students who have these characteristics or who are going to meet the needs of their particular population. So those are things that we consider as we're looking at the application process. It's also a bonus if people have previous experience with birth and midwifery, or if they're a nurse, previous labor and delivery experience. Spanish language skills are also a plus. Are these required? No. But when we look at our highly competitive application pool and we're trying to determine which 25 to 30 individuals are admitted, these are bonuses when we're looking at those. In general, we admit around 30, 35, and we are actively trying to make sure that that cohort as a whole looks good and represents what we want to see in midwifery moving forward. So, some notes on the application process for fall 2020. We are excited that you have applied. Usually in previous years we had done interviews. This year we're not doing interviews. That's a school-wide decision not to do interviews. There was concern that they really don't do a good job of differentiating applicants. And we are also really moving towards a holistic review process. And some of the consultants that we brought in from other schools felt like interviews might have a potential for bias. And so we're going to see how it goes not interviewing this year. You can expect to hear about your application from mid to late February, again, depending on whether it snows in February. Sometimes that delays us a few days, but we are actively looking at all applications. Every single application receives a thorough review. And then what we do is we admit only students who we have room for. So we're not over admitting. We will admit students who we honestly have spaces for. That means we're not sending out huge numbers of initial acceptance letters. And it means that we put a lot of people on a wait list. Now, think about it. If we send out 30 letters, maybe 10 of those people also applied to other schools that may perhaps be closer to their home, or maybe they decide in the end that they're not going to select Vanderbilt. While that's sad for us, because we would have really loved to have them come and be with us, we want to make sure that there's a good fit between the student and the school. So when those people return their form to us or put in slate that they aren't interested in coming, we then will admit 10 other students from our wait list. So our wait list moves. If you are waitlisted, that does not mean you did not get in, because our wait list moves so quickly. So a lot of times we will get pretty deep into our wait list and admissions because we're not over admitting in that first flush of applications. I also often get questions about whether we review individual applications after the fact. So if someone didn't get in, will we give them an individualized review to talk about ways that they could be more successful? We don't, but I think I will send out, I will put up a webinar about ways to make your application more successful, because I think several people have that question. It really is the information on the previous slide. So if, for instance, you don't get in on this round, do think about getting doula experience if you can. Do think about learning Spanish, particularly medical Spanish. Do think about other ways that you can make your application more successful. We will look at your application again if you want to reapply. So we are super excited that you have applied, and we are very much interested in admitting the best possible cohort who will be extraordinarily successful in our program and in advancing our profession. Thank you. If you have any further questions, see our frequently asked questions list on the website. We have a pretty extensive frequently asked questions page that may help you. If not, contact me via email. My email is also online. We are interested in answering the questions that you have so that you can determine if Vanderbilt is the right school for you. Thanks.